This again is a product from GC, and I'm not aware if other companies are making it. They might be, but this came about, or this was developed in response to a lot of practitioners. Of course, my opinion was not asked for, but if it was, I would have said this myself. One, a lot of dentists don't have a triturator or an amalgamator anymore in their practice. We do. That was not our problem, but the problem is the capsule, it comes in one size. So whether you have a small little pit and fissure lesion to fill, you have a large MODBL situation, you have one size that must fit all. So there is a lot of waste. If you're doing a small class 5, you're doing a small class 1, you waste a lot. And of course, if you're a practice that doesn't have an amalgamator, this is a two-paste system. So Fuji Automix LC is a two-paste system. It comes with this ergonomic dispenser, so you don't waste as much, even though there is, some amount that's wasted because it has to mix. The two pastes have to mix in this little spiral tip. Still, a little less waste than, in the powder liquid system in the large capsules, and you don't have to have an amalgamator. I guess it is also handy if you're going to use it at a mission trip out in the field. You don't need an amalgamator. It mixes in this spiral tip here, and you can simply inject it into the prep. So some advantages to this. It is a light cured material. It is not a conventional glass ionomer. It is not a liquid powder acid base reaction. It does have some composite resin added. So technically it is a resin modified glass ionomer. It is the letters LC, it's light cured. Two-paste system. It does minimize the air bubble entrapment because, the material is mixing in this long spiral tip here, does have better consistency, but it is not a true glass ionomer. The true glass ionomers, which, have the best chemical bond to tooth structure, the best fluoride release, therefore the best known karyostatic properties of any material known to dentistry at this time as a restorative materials are the conventional glass ionomers. No composite resin added, strictly a conventional glass ionomer with an acid-base setting reaction. EQUIA and EQUIA Forte are examples of true conventional glass ionomers with all these properties that we've talked about, not just the chemical bonding and fluoride release, but also the moisture forgiveness, the thermal coefficient of expansion being similar to tooth structure. And that's a very big deal, the thermal coefficient of expansion being the same as that of tooth structure. So EQUIA has now been shown to be a reliable long-term restorative solution among the true glass ionomers on the market. In my practice, I've always used the materials from GC only because of my familiarity with these products. We use them in dental school, we taught them in dental school, and I've continued to use them in my practice.